Hi, I'm Dr. Todd Nelson. I'm a naturopathic doctor in Denver, Colorado. I've been serving the Colorado area for over 30 years. My specialty is clinical nutrition for people that are chronically sick or for people that want to prevent becoming chronically sick. I'm really excited today to talk to you about some very new breakthroughs clinically for overcoming the risk to some of the most common chronic illnesses in America. Illnesses that are really killing people left and right. For example, heart disease. 1 in 2 people are dying of heart disease now throughout America. So I want to give you a little bit of an overview first as to what actually is happening. Then I want to give you some solutions that are very new, very exciting, very highly researched, and things that you've never heard about before. First, it's really amazing to find out that 1 in 2 Americans are living with chronic illness on a daily basis. As a matter of fact, 78% of all healthcare expenditure in this country for chronic illness is for managing chronic illness, but not doing anything to prevent it, nor to overcome it once you get diagnosed. Have you ever heard of metabolic syndrome? Most people haven't. It's actually the most common chronic risk for disease in America. When I do lectures all over the country, I ask audiences, how many of you have heard of metabolic syndrome? Hardly anybody raises their hands. But in fact, 1 in 3 Americans have it and don't know that they do. I want to take you through this slide to show you the signs and symptoms for having metabolic syndrome. I want you to think about if this might be you or a loved one that might have these kind of parameters that are putting you at risk for very serious illness. First and foremost, here's a simple test you can do at home. Just take out a tape measure and put it around the thickest part of your waist. For men, if your waist at the thickest point is larger than 40 inches, guess what? You're at risk for metabolic syndrome. Women, if it's over 35 inches, then you're at risk for metabolic syndrome. So what the heck is metabolic syndrome? Well, first and foremost, it's insulin resistance. It means that, let's say if you're eating too much junk food, you're not exercising as well as you should, your weight's starting to go up, you're not feeling as good, and worse, you're starting to get some blood chemistries that are abnormal. This could be putting you at risk for metabolic syndrome. So the way that the National Institutes for Health and other organizations define metabolic syndrome, it's if you have 3 or more of the following parameters. Number 1, having a big belly, like we just talked about. That's something that you can freely measure at home. Secondly, if your blood sugar or your glucose fasting in the morning is over 100, that's another risk factor. Next, your HDL or your so-called good cholesterol should not be below 30. If it is, that's yet another risk factor. Next, one of the most prevalent fats that we have in our body is called triglycerides. If that's riding too high, above 150, that's a very strong risk factor for metabolic syndrome. Now, further risk factors for metabolic syndrome is if you're pre-diabetic. The way you find that out in a blood test is if your A1C, which is a 3-month marker of your average blood sugar, is running from 5.7 to 6.4. Then you're right on the border for diabetes, and that really needs to be seriously considered. Also, if your fasting blood sugar, in other words, when you get up in the morning and you get a blood test, is over 100, that's another risk factor that you need to take into consideration. If you have any 3 of the markers that I just talked about, most likely you have got metabolic syndrome. And the fact is, a lot of patients don't feel that bad. They might have abnormal chemistries, they might be gaining weight, but so far you're not feeling that bad. But what we know scientifically is once you go into metabolic syndrome, you're 50% more at risk for both cardiac disease or heart disease and diabetes. According to the Centers for Disease Control in Atlanta, Georgia, even if you have 2 of these markers, the likelihood of death is increased 2 times or twice. So just 2 markers being off you're at much more risk for early premature death. And if you have 4 markers or more, you're 3.5 times as likely to die from metabolic syndrome. Now, interestingly enough, over the years, I've had the privilege of coaching and guiding people on lifestyle, what we're calling now lifestyle medicine. All that is eating more effectively, exercising your body, breathing well, lowering stress, and integrating sophisticated medical-grade dietary supplements. Interestingly enough, even the premier medical journals and medical establishments are beginning to recommend lifestyle medicine as the first intervention for these chronic problems rather than drugs, rather than common medicine. Let me just show you one study that was recently done about lifestyle intervention. So on the slide, you can see that leading healthcare organizations and medical experts agree that lifestyle interventions, or lifestyle medicine it's now being called, should be the first line of treatment for many chronic health problems. Now, I want to emphasize that this is first line of treatment rather than drugs, surgery, and other medical interventions. This is for high cholesterol, high blood pressure, high blood sugar, type 2 diabetes, heart disease, arthritis, osteoporosis, metabolic syndrome, which we've been talking about, and menopausal symptoms. And this is recommended by many different institutions like National Institutes for Health, American Heart Association, and the American Cancer Society. Let me share with you one study about lifestyle medicine that's being validated by scientific research. This first one, there's a quote here from this paper. It says, "Lifestyle interventions are the initial therapies recommended for treatment of metabolic syndrome. If lifestyle change is not sufficient, then drug therapies for abnormalities in the individual risk factors may be indicated." So my point here is, more and more, it's being recommended that changing your lifestyle and intervening in those areas that you actually have choice, like the foods you eat and how you exercise and how you reduce your stress and how you take dietary supplements, that lifestyle medicine is the most important intervention, the first line of intervention, way before you get a drug prescription. Now, here's something really exciting that I want to share with you. Recently, it's been found that utilizing a medical food drink, almost like a protein shake, along with a lifestyle medicine intervention process, actually dramatically reduces risk to heart disease and diabetes better than anything ever measured. I want to share with you what's on this slide, medical food and lifestyle medicine for risk reduction. This is based on a 12-week, 3-university trial. In other words, 3 different universities participated in a 12-week clinical trial with people utilizing a new medical food called Ultra Meal Plus 360, along with lifestyle medicine intervention, meaning dietary change and exercise. What they found in that 12 weeks, at the end of it, and I'll be sharing a slide about this in just a moment, that the trial reduced 8 major risk factors in only 12 weeks. And 43% of the participants no longer had metabolic syndrome criteria, meaning their metabolic syndrome numbers actually went away. This was found to be more effective in improving clinical markers than any medication ever studied for these risk factors. Look at this slide. This is really interesting. This is one of the studies that was done. This is Ultra Meal, was found to be better than the American Heart Association diet for reducing 14 cardiovascular risk factors. Now, no drug can do that. If you closely look at this slide, on your left, in the sort of violet column there, the total cholesterol was reduced by 16%. If you look to the right, this is the American Heart Association diet in 12 weeks, only reduced cholesterol by 1%. Now, we could go all the way through this list, but what's really significant, let me skip down. All the blood fats improved. All the cholesterol numbers improved dramatically on the left side compared to the right side, which is the American Heart Association diet. On the left side, it's just drinking the ultra meal along with what's called the first-line therapy diet. This group also lost an average of 14.8 pounds of actual body fat, whereas the American Heart Association group lost only 7.5 pounds. The ultra meal and first-line therapy group also gained lean muscle mass significantly. And this is vital when you're trying to reduce metabolic risk, is to have these kinds of outcomes. This was done naturally, harmlessly, with no side effects, and with no drug dependency. Let's look at this next slide. This slide summarizes what I mentioned before about another 12-week randomized open trial study, it's called, and this was coordinated between the University of California, Irvine, the University of Florida, and the University of Connecticut. Now, again, if you look at just the middle of the slide, on the left-hand column with all the numbers, I know it's a little bit complicated, but bear with me. This was using Ultrameal plus 360, the medical food that's studied for metabolic syndrome, along with diet and exercise, versus the right-hand column with diet and exercise alone without the medical food. If you compare the numbers, it's really quite dramatic as to the comparisons of the changes of the blood fats, blood pressure, and weight changes from the left column with the medical food versus the right column that's just doing diet and exercise alone. So what I found with this in my own clinic, in my own experience, is those people that are working diet and exercise alone, sure, you're going to get some outcomes. You're going to actually change some of these numbers in your blood, change your weight, change your blood pressure. But when you add the Ultrameal plus 360, those parameters change dramatically to the point where you can actually even reverse the risk factors. Okay, so I just showed you a couple of complicated slides that are showing complicated studies, but just trying to emphasize that you can very naturally and simply get these outcomes even within 12 weeks by doing just this. Here's a summary on this slide that says, here's what it boils down to in your everyday life. This is what you're going to be doing on first-line therapy day in and day out to get these kind of outcomes. Very simply, it's just drinking 2 scoops of Ultrameal twice a day, along with a low glycemic, meaning low simple sugar, personalized first-line therapy diet that I take you through and personalize. The Ultrameal plus 360 is available either with a soy base or a rice base in case you're soy sensitive. You combine it with some moderate exercise on a daily basis and some personalized medical-grade dietary supplements. Along with the program, you get a personalized first-line therapy guidebook that takes you through how to do the diet, how to exercise, explaining the dietary supplements that are being utilized on a daily basis. And then you have forms in the guidebook to help you track your progress. This is one of the most vital parts of the program, is getting support, tracking progress, and getting measurable outcomes in your numbers. The first thing I do when I see you for first-line therapy is an hour-long, in-depth, personalized evaluation. One of the tests that I perform is called a BIA body composition test. It's a very simple, harmless, very accurate test for measuring your body fat, your lean muscle mass, your metabolic rate, and this gives me a baseline as to where is your body composition today when we start. This also helps me get the diet very exact as to how much food do you need, what kind of food do you need, and then we can coach you over the next 12 weeks, usually seeing people once or twice a month during that time, and periodically retesting the BIA, making sure that you're really achieving the results you want. Here's one of my favorite patients, one of my favorite cases that I want to share with you, just to make this very real. This is Dale. Dale came to me after he had had a physical. He's a Boy Scout leader. He was getting his annual physical for Boy Scouts. He's also a preacher. Much to his surprise, he found out that he was actually getting very sick. His blood chemistries were off the chart. His blood pressure was up. Let me share with you just a couple of details about Dale. When he went in, he found out that he had type 2 diabetes. In fact, his blood sugar was 398. And his A1C is a marker for a 3-month blood average, was 12.8. That is very, very high. He had very high blood pressure, very high cholesterol. His triglycerides were so high that they couldn't measure his cholesterol. He was 287 pounds. He was complaining of constant fatigue. And he was immediately put on blood pressure, cholesterol medication, and insulin because his diabetes was so mismanaged. So Dale came to see me somewhat desperately. He's got 3 kids, he's in his 60s, he wants to live life a little bit longer, and he was on the fast track to a heart attack. So he came in to me for first-line therapy. I did an evaluation, did his baseline, got him set up on the food program, got him set up on the drinks and the supplements, and let's take a look at what happened to Dale after he's been working the program for a while. Now, Dale's been doing first-line therapy longer than 12 weeks. Actually, he's been doing it for 2 years. So after Dale's been working the program for a long time, you can see that he's dramatically changed. Let me share with you a couple of his statistics. After 2 years, he's virtually off insulin. His weight is now about 220, and he's losing still. His average fasting blood sugar is 104. His A1C, remember, it started at 12.8. It's now 4.4, or non-diabetic. He has virtually normal cholesterol. He's off blood pressure and cholesterol medication, and he's feeling great. Now, this can be you as well. So I've taken you through what metabolic syndrome is, what kind of chronic risk factors to look for. If this is you, if you think you have some of these risks and it's time to take some action about it, I would be very happy to evaluate you, start testing you, and get you on your 12-week program to start achieving success for a lifetime. If you have a coupon for this program, please call the office to redeem it, take some money off the program. I'll be looking forward to meeting you and supporting you for your success. Thanks for watching.